So the Juliet laser is a very safe, it's a non-invasive treatment, and this gently releases energy, like light energy, into the vaginal tissue. And the aim of the Juliet is mainly to enhance sexual and vaginal health in all women. So basically, the Juliet uses a specialized type of laser called erbium laser, and this releases light pulses to the vaginal tissue. And this is a very similar, the same type of laser that is used for facial resurfacing procedures and also in dentistry in applications. And the reason why this laser is preferred is because it's more gentler than other traditional type of lasers. And the Juliet doesn't use any drugs, any hormones, or it makes any cuts in the vagina, so no incisions. It takes less than 15 minutes to do in clinic with minimal discomfort to the women, and it's changed the lives of thousands of women. So this laser can be used for a variety of treatments. Millions of women do suffer from vaginal dryness, painful intercourse, loss of urine when coughing, sneezing, or when they get a feeling that they need to rush to the toilet. Lots of women suffer from recurrent urine infections, and the Juliet has shown to improve these conditions in a number of women. In addition, the Juliet can be used to tighten the vagina and strengthen the pelvic floor muscles following childbirth, and in the long run prevent prolapse, the condition of prolapse. There's a condition called lichen sclerosis where women suffer from the itching, soreness in the vagina, the loss of the anatomy of the vagina changes, the vulva changes, and the Juliet is shown to improve those conditions as well. It can also treat conditions such as vaginal warts and small lumps and bumps of the vagina by removing them without having to make a cut in the vagina, and therefore improve there's no scarring, so it doesn't leave the vagina with any scars. And for the second question, that what are the unique benefits and advantages? Well, the Juliet, you don't need an anesthetic. So women that have lots of medical problems that would otherwise need a surgery, for example, to treat stress incontinence, which is the leaking of coughing and sneezing when they pass urine, or if they have, or to tighten the vagina, would need a general anesthetic. Then with the Juliet, you don't need a general anesthetic. So women that are unable or not fit for surgery can have this procedure. The Juliet is a non-invasive procedure, so very easy to do with minimal discomfort. Women that have had cancer, for example, breast cancer, and are unable to take HRT, which is hormonal replacement therapy, or vaginal estrogen, for example, can benefit from the Juliet to help with the vaginal dryness, the painful intercourse, or the urinary symptoms. It is also benefit for women that have that after childbirth may not have the time or forget to do the pelvic floor exercises and want a procedure that is not time consuming and quite fast to help strengthen the pelvic floor muscles. That's always an option as well. And women, it's also the advantage of, for example, for women that have suffer from lichen sclerosis, which is a condition of the itching and soreness in the vagina, who normally we give steroid creams to help with the symptoms. It doesn't treat the condition, but it helps with the symptoms, the steroids. The laser is an advantage that you don't need to take a steroid cream. Some women may not be allergic to the steroid cream or may not find any benefits, so the laser is always an option. And for women that have the vaginal warts or any other lumps and bumps of the vagina, again, they don't need to have a cut to remove those lumps or have any stitches. The laser will easily treat those conditions. So the Juliet uses a small probe, similar to when a woman has to have a vaginal ultrasound. or when you use a small speculum, that we use, it's the instrument that we use when we do a smear test. So it's similar to the it's a very small probe that goes in the vagina, and the unique laser then delivers 2 passes of energy. So it's done at two stages. The first stage, it's called the ablation stage, and the laser is released to the vagina, and the second passage is a warming effect. And both of them, what they actually cause is micro damage to the vagina. So it's you think we're doing the opposite of what we're meant to be doing, but the micro damage to the vagina then stimulates the formation of new blood vessels, nerve endings to the vagina, and therefore will lead to the production of elastin and collagen. And with a new elastin and collagen, the vagina will tighten, the pelvic floor muscles will tighten, and there'll be an increase in lubrication. So depending on what the age of the patient is, or how thin the vaginal tissue is prior to the procedure, the laser frequency is altered according to the individual. And most women will find an improvement after the first treatment. Immediately they'll feel the vagina tighten. And women that have had were doing this for stress incontinence, you'll find significant improvement with stress incontinence within the first 2 weeks of having this procedure done. I'd say each Juliet treatment takes about 15 minutes to do, with minimal discomfort. Women describe it as a feeling. They'll feel a feeling of warm sensation of the vagina and a tapping type of sensation. But we haven't had any women asked for the procedure to be stopped because of discomfort. And it doesn't require, as we said before, any anesthetic or any local anesthetic within the vagina. So the risks associated with this procedure are minimal, and the reason being is because the Juliet uses a type of ablative laser, which is very gentle. It causes the micro damage to the deeper layers of the vaginal mucosa without actually injuring the tissue. And for this reason, the risks associated with traditional surgery, such as bleeding, scarring, infection, are basically virtually eliminated with the Juliet treatment. And therefore, anesthesia is rarely required. What some women may experience is in the first 3 to 4 days after the treatment, they may notice a bit of pink discharge, and this is normal. A bit of maybe burning on passing urine just the first 1 or 2 days. Again, this is normal, but overall, there's not really many risks or side effects associated with the procedure, other than a bit of mild discomfort, as I mentioned, in the pink discharge. So there have been numerous studies that have been performed using the Juliet laser, both to look at the improvement of vaginal atrophy, to look at the improvement of stress incontinence, also for women that suffer from very painful intercourse called vaginismus, when the muscles go into spasm. And all of them have shown improvements with these conditions. The most recent study that looked at safety and the efficacy of the vaginal laser, the Juliet, reported that there was an improvement in tightening in 95% of women, and 85% of their partners also reported a greater sexual satisfaction after the women have had the vaginal laser treatment. Depending, most women that are having the laser treatment for vaginal atrophy may require up to 3 treatments, with a top-up every 18 to 24 months. Women that have had this treatment would expect to see an improvement after 14 days. And after the first treatment, that's when they'll get them quite a significant improvement in their symptoms. After 4 to 6 weeks, they may require a second treatment. And after the third treatment, they would find a significant improvement in their stress incontinence and vaginal atrophy. And they'll feel that the feeling of a tightening in the vagina as well, and increased they'll notice a visible increased lubrication, and may not need to require, they may not require using vaginal estrogen or any lubricants with intercourse following the treatment.